Hi, I'm Dr. Ken Berry, family physician, and I want to discuss with you for the next few minutes a very important topic. And I've actually received hundreds of requests to do videos about type 1 diabetes. And so this is going to be my first video specifically about type 1 diabetes, and I hope it helps you a lot. It's entitled Five Steps for a Type 1 Diabetic to Go Low Carb. There's over 1 million people in the United States alone with type 1 diabetes. And so this is a very important subject. And I think this is really going to help you to manage your diabetes easier and safer than you have been in the past. If you know someone with type 1 diabetes, please share this video with them on Facebook or Twitter or Instagram. Help me to help them understand what's up with type 1 diabetes and how they can better manage this so that they don't have the disastrous complications that come in the future with poorly controlled type 1 diabetes. Now, low carb is very, very safe for type 1 diabetics and type 2 diabetics as well. Whether you're doing just low carb, whether you're doing a ketogenic diet, or whether you're even doing carnivore, which is essentially zero carbohydrate diets, they're all perfectly safe and healthy for both type 2 diabetics and type 1 diabetics. The American Diabetes Association has already added a low carb option for the treatment of type 2 diabetes, and within the next few years, they'll be adding a low carb treatment option for type 1 diabetics as well. There's actually a new study out a few months back showing hundreds of people managing their type 1 diabetes very successfully with a low carb diet. And I'm going to post a link down below in the show notes. So let's get into this and talk about type 1 diabetes and the low carb diet. Type 1 diabetes is more complicated to transition from the standard American diet or the American Diabetes Association diet to a low carb diet. It's not impossible, and it's actually a much preferable diet to the ADA diet if you would like to have normal blood sugars and a normal A1C and much less chance of having hypoglycemic episodes. Then you definitely want to transition to a low carb diet. Type 2 diabetics can do this. They can just basically do it overnight or within a few days or a few weeks. Type 1 diabetics can absolutely and should absolutely transition to a low carb diet, but you have to do it based on these 5 steps. So let's get into these. Step number 1, and this is by far the most important step because a type 1 diabetic obviously has an increased risk of having super high blood sugars, 400, 500, 600, 700, and developing ketoacidosis if they miscalculate their carbohydrate intake and their insulin dosage. They also have a much, much higher risk of having hypoglycemic episodes. So you got to consult your doctor. That is absolutely step number 1. Do not begin a low carb diet until you've talked to your doctor. If your doctor is 100% opposed to a low carb, keto, carnivore option for you, then I would counsel you to maybe get a second opinion. And I'm going to link a video at the end of this video about how to find a low carb doctor. It'll be either in this corner or this corner. I never know which. But you might want to get a second opinion because more and more thousands of patients and hundreds of doctors are realizing that a low carb diet is the proper diet for a type 2 diabetic and also a type 1 diabetic as well. So step 1, go see your doctor and talk about this. You don't need to try to do this alone at home. You need to do this hand in hand with a knowledgeable doctor who knows at least a little bit about the low carb way of eating. Step number 2 is to get a continuous glucose monitor. You may have, now hopefully you already have one if you're a type 1 diabetic. It's the little monitor that goes here. It measures your serum. Actually, it measures your interstitial fluid blood sugar every 5 minutes. There's an app on most phones now that connects with it. And so you can watch your blood sugar every 5 minutes to see exactly what it does when you eat certain foods or when you don't eat certain foods. I hope you already have one, but if you're a type 1 diabetic and you don't have a CGM, you need to get one ASAP. That will help you so much to understand what eating too many carbohydrates does to your blood sugar, or when you eat a more balanced low carb meal, how that keeps you from having the blood sugar spikes. And then also, most of the CGMs have an alarm on them. So if you start to have a hypo episode, it'll give you a heads up before you start having the symptoms so you can have time to pull over or do whatever you need to do to get your blood sugar back up. Step number 3 is you need to download Chronometer or one of the macronutrient tracking apps on your phone. You can do this on your laptop or you can just look it up in a book, but it's far easier to do it with one of the apps you can download on your phone. Unless you have a degree in nutrition or dietetics, you don't know how many carbs are in most foods. You don't know how many grams of protein are in most foods. And so for the first 2 or 3 months of transitioning to a low carb diet, you need to look up every single food so that you know how many grams of carbohydrates are in there and also how many grams of protein, because both are going to affect your blood sugar, as you already know. Now, you also already know as a type 1 diabetic that there's always a margin of error. Just because the app says there's 10 grams of carbohydrates in what you're about to eat, there could be 8 grams, there could be 12 grams. And that's part of the problem. And in a future video I'm going to make on this channel about the benefits of low carb, that's going to help you with that as well. But you absolutely have to have a macronutrient tracking app of some kind, whether it's just a piece of paper or whether it's an app on your phone. That is vital for you to understand how many carbohydrates and how many grams of protein are in your food. Step number 4 is you must go at this slowly. You cannot do like perhaps your type 2 diabetic uncle or mom did. You have to do this slowly. This needs to be probably a 1 month to 3 month transition. And so what I recommend for my patients that I see with type 1 diabetes is let's decrease. First of all, use the macro tracking app to figure out how many grams of total carbohydrates you're eating a day, because I bet you don't even know that, right? Or you may be surprised when you download the app and add it all up. But once you know, okay, on average, I'm eating 200, 300 grams of carbs a day, then I want you to start decreasing the amount of carbohydrates you eat, probably 10% a week. And that way you can also adjust your insulin dose as you go, whether you have a pump or whether you do a bolus plus immediate release and then long acting. Either way, you can adjust your insulin so that you don't have the hypos that you would have if you just try to do this blindly. So go slowly. I don't care if it takes you 6 months to transition to low carb. What I definitely don't want you to have is super high episodes of 400 or 500 if you miscalculate. And then even worse than that, I certainly don't want you to have hypo episodes where you pass out or, you have problems like that. So we don't want that. So please go slowly. There is no rush, especially if you're a parent of a type 1 diabetic watching this and learning about it for your child's benefit. You've got months. You can take a year to transition to low carb. There's no rush. Please don't be in a hurry to do this. Step number 5 is to read Dr. Bernstein's book. He is a type 1 diabetic physician. He is in his 80s. He still practices 6 days a week. That's what a type 1 diabetic can hope for. You can literally be in your 80s or 90s and still be fully functional with very minimal complications from your type 1 diabetes if you start taking care of it now. I'm going to put a link to Dr. Bernstein's excellent book. Any doctor who talks about low carb and type 1 diabetes, Dr. Bernstein is one of the giants upon whose shoulders we are standing. He is the maverick, the pioneer. He is the man when it comes to low carb and type 1 diabetes. So get that book and read it if you haven't already. And then a bonus step 6, is join a Facebook group called Type 1 Grit. I'm going to put that also in the show notes down below. There are thousands of type 1 diabetics who are using either low carb or keto, and some even using carnivore to have normal A1Cs, to have almost never have a hypo episode, and to very rarely have a hyperglycemic episode. So join that Type 1 Grit group, and that way you've got a huge built-in Type 1 low-carb family. And if you have a question, they have multiple frequently asked questions that they answer there, or you can just type a message and ask a question that way. Either way, that is absolutely vital that you follow all 6 steps so that you do this safely, you do it as quickly as possible without rushing it, and then you get to enjoy all the benefits of doing low carb as a type 1 diabetic that I'm going to talk about in my next video on this channel. So if you haven't already subscribed to this channel, click the subscribe button and the little bell right beside it so that when I post the video about all the benefits of doing low carb with as a type 1 diabetic, you'll be one of the very first to see it. All right, this is Dr. Berry. I'll see you next time.